Senator Husted.
Thank you, Mr. Chairman. Thank all of our witnesses for being here today. I'm hopeful that this is one of those issues that we can have some great bipartisan progress on, because I think we all care about making sure that everyone in America has access to health care, but part of having access is being able to afford it. And we have a situation in this country where we spend far more. I mean, it's not for lack of effort in terms of how much it costs to provide health care that we're in this challenge. 18% of our economy is committed to health care. That's $5.26 trillion a year, far outpacing per capita what any other country spends on health care. But it reminds me, I grew up very rural. It reminds me when I was a little kid, I went with my dad to buy a used car. And when we walked up to the guy who had the car to sell, he said, my dad said, "Well, what do you want for the car?" And he looked back at him and said, "Well, how much do you have?" Right? If you don't know the price of something, pretty hard to know whether you're getting a good deal, have a negotiation. In this country right now, we have no idea what we're paying for health care when we're as consumers, whether you're an employer, an individual, somebody buying a health care program. None of us know. In most markets, we know. We know what the price is. We walk up, we know what not in health care. It's a mystery. None of us really know how much it is. And so that's, it seems to me that's a fundamental component of trying to figure this out. Mr. Coleman, you have thoughts on that?
Thank you so much for the question, Senator. I do have a lot of thoughts of that. I would say about 95% of my time now as a researcher is actually spent on the issue of the application of artificial intelligence within healthcare, because it's one of the most promising mechanisms we might have to be able to curb healthcare costs. People tend to forget that our insurance costs are largely I'm sorry, thank you, Senator. People tend to forget that our health insurance premiums are largely reflective of the costs of medical claims, and we need to find ways to be able to reduce the costs. You know, right now the costs of our hospitals, our physicians are way out of line with comparable nations in Europe. As you mentioned, 17.4% of our GDP is spent on healthcare. We need to look at that healthcare delivery issue, because that would really further enable the savings potential of the work we're discussing today on things like association health plans.
So additionally, when you think about labor unions, they come together, they represent their members, they negotiate for better wages, working conditions, health care, all benefits. But as an individual independent contractor, if I want to drive a car or have a small business, and Ms. Cavan, maybe you can answer this. Do I have the same ability to come together and negotiate under the law as you would as an individual, as an employee in a business or a union?
You're talking about the health plans?
Yeah, with health plans.
We need better access to the group rates.
Yeah.
This is not my personal area of expertise, but just asking everybody, knowing, I've been an independent contractor for more than 2 decades now. We're getting killed on these individual rates, and we need equal access to the group rate plans.
Yeah, Ms. Onwuka, do you have thought on that?
Nothing particular. They've said everything.
Yeah. Mr. Coleman?
I have much, the same opinions, that we need to find ways to be able to aggregate independent contractors so they have more leverage in negotiations on things like health insurance.
Yeah, because if you want to get a better price, you have to have the ability to know what the price is and improve your negotiating power so that you can figure out how to get the best deal for yourself.
Absolutely. It's literally the basis of the group health insurance market.
And we need to do better on that front. I just want to say that this is an issue of healthcare. When I think of small businesses, and we just passed, by the way, in the big beautiful bill, we help Social Security. We help small businesses. We help people have more money in their pockets to be able to pay for audit. But healthcare is going up. The cost is going up so fast. And if you don't have the ability, you make so many decisions in your life as a family member based on whether or not you can have health care, where you're going, where you are, where you change. And I hope that, Mr. Chairman, we'll work very closely together to improve the way that we're serving all of our customers, the people of the country. Thank you.
And I just want to note, Ms. Friedman has been saying that only 50% of workers have access to defined benefit or defined contribution plans. But I'll submit for the record a CRS report based on IRS data showing that almost 80% do. So just to point that out.
Thank you very much, Senator Cassidy. I'd like to suggest that I'm talking about 50% who participate in a plan. If you're talking about access, it's a slightly different issue.
Got it.
So, yeah, I'd be happy to share that with you, but thank you very much.